Welcome to another video of Microbiology and Immunology Unit 4, V-2, Immunology. Let's start. Definition of vaccine. A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. It typically contains an agent resembling a disease-causing microorganism, often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. The vaccine stimulates the body's immune system to recognize the agent as a threat, destroy it, and remember it so the immune system can more easily recognize and destroy any of these microorganisms it encounters in the future. Common vaccines against vaccine-preventable diseases in Nepal. Nepal's National Immunization Program, NIP, includes vaccines against the following diseases. Disease vaccine used. Tuberculosis BCG. Diphtheria, pertussis, tetanus DPT. Hepatitis B vaccine. Haemophilus influenza B HIV vaccine. Polio OPV, oral polio vaccine, IPV. Measles, rubella MR, measles rubella. Japanese encephalitis JE vaccine. Pneumonia, meningitis PCV, pneumococcal vaccine. Rotavirus diarrhea rotavirus vaccine. COVID-19 Covishield, varicella, etc. Typhoid, recently introduced, typhoid conjugate vaccine. Laboratory tests procedure overview. 1 intradermal skin test, MAN2 test for tuberculosis. Purpose, to detect latent or active TB infection. Procedure. Inject 0.1 ml of PPD, purified protein derivative, intradermally on the forearm. A small wheal should appear. After 48-72 hours, measure the induration, not redness. Interpretation depends on the size of induration and patient risk factors. 2 VDRL, Venereal Disease Research Laboratory, test. Purpose, screening test for syphilis. Procedure. Mix patient's serum with cardiolipin antigen on a slide. Observe for flocculation, clumping. Positive test indicates the presence of reagent antibodies. 3-ASO titer, anti-streptolysin O. Purpose, to detect a past infection with group A streptococcus. Procedure. Patient's serum is mixed with streptolysin O antigen. Agglutination indicates presence of ASO antibodies. Normal range, 200 IU/ml, may vary by lab. 4-RA factor, rheumatoid arthritis factor. Purpose, to detect rheumatoid arthritis and other autoimmune diseases. Procedure. Patient's serum is mixed with IgG-coated latex particles. Agglutination indicates the presence of RA factor. 5-CRP, C-reactive protein, test. Purpose, to detect inflammation or infection. Procedure. Quantitative or qualitative test using latex agglutination. High CRP levels suggest inflammation, infection, or tissue injury. 6-Whittle test. Purpose, to diagnose typhoid fever. Procedure. Serum is mixed with salmonella antigens, O, H, A, BH. Agglutination indicates presence of antibodies. Titers 1:80, O, and 1:160, H, may suggest infection, varies by endemicity. 7 Brucella agglutination test. Purpose, to diagnose brucellosis. Procedure. Serum mixed with killed Brucella antigen. Agglutination indicates presence of Brucella antibodies. Titers 1:160 are generally considered positive. MCQs most important. 1. Which of the following vaccines is used to prevent tuberculosis? A. DPT. B. BCG. C. OPV. D. HIV. Answer, B. 2. The MAN2 test is used to diagnose which disease? A. Syphilis. B. Typhoid. C. Tuberculosis. D. Brucellosis. Answer, C. 3. What is the route of administration for the BCG vaccine? A. Intramuscular. B. subcutaneous. C. Intradermal. D. Oral. Answer, C. 4. Which of the following is a live attenuated vaccine? A. Hepatitis B. B. DPT. C. BCG. D. Tetanus toxoid. Answer, C. 5. Whittle test is used to diagnose which of the following? A. Tuberculosis. B. Typhoid fever. C. Measles. D. Syphilis. Answer, B. 6. What is tested in the VDRL test? A. WBC count. B. Reagent antibodies. C. ASO titer. D. CRP. Answer, B. 7. Which vaccine is given at birth in Nepal under NIP? A. Hepatitis B. B. BCG. C. DPT. D. JE. Answer, B. 8. Which test helps in detecting inflammation in the body? A. ASO titer. B. RA factor. C. CRP. D. VDRL. Answer, C. 9. The presence of anti-streptolysin O, ASO, antibodies indicates a recent infection by A. Mycobacterium tuberculosis. B. Salmonella typhi. C. Streptococcus pyogenes. D. Treponema pallidum. Answer, C. 10. RA factor is mainly used to detect A. Rheumatoid arthritis. B. Malaria. C. Typhoid. D. Influenza. Answer, A. 11. Which of the following is not a vaccine-preventable disease? A. Diphtheria. B. Tetanus. C. Hypertension. D. Measles. Answer, C. 12. Which component is used in the Whittle test? A. Cardiolipin. B. Brucella antigen. C. Salmonella antigen. D. Latex particles. Answer, C. 13. What type of reaction occurs in agglutination tests? A. Precipitation. B. Agglutination. C. Neutralization. D. Hemolysis. Answer, B. 14. JE vaccine is used to protect against A. Japanese encephalitis. B. Joint effusion. C. Jaundice. D. Juvenile epilepsy. Answer, A. 15. The ideal time to read the MAN2 test is A. After 12 hours. B. After 24 hours. C. After 48-72 hours. D. After 7 days. Answer, C. 16. What is the interpretation of a positive VDRL test? A. HIV infection. B. Tuberculosis. C. Syphilis. D. Hepatitis. Answer, C. 17. Which disease is caused by Brucella species? A. Typhoid. B. Brucellosis. C. Malaria. D. TB. Answer, B. 18. Which test is helpful in diagnosing enteric fever? A. Whittle. B. RA. C. CRP. D. VDRL. Answer, A. 19. Which of the following vaccines is given orally? A. BCG. B. DPT. C. OPV. D. Hepatitis B. Answer, C. 20. Which of the following is a conjugate vaccine? A. BCG. B. DPT. C. Typhoid conjugate vaccine. D. OPV. Answer, C. Thank you guys for watching, and for more videos subscribe the channel and hit the bell icon for more videos.